In this mental health care series, we are going to be talking about disordered eating, items to look out for in others, typical healthcare process, and national resources available. As a frontline healthcare provider, athletic trainers typically will be responsible for recognizing these behaviors and helping connect with appropriate healthcare teams. Fellow student athletes, coaches, and athletic staff may also see and hear signs, so we wanted to be sure to list out what items to be aware of. Eating disorders may present in the following ways. Some physical symptoms to be aware of, in females specifically, would be amenorrhea or a lack of menstrual cycle, dehydration, gastrointestinal problems, cold intolerance, frequent stress fractures or stress-related injuries and overuse injuries, significant weight loss or gain over short durations of time, muscle cramps, or dental and gum issues. Some psychological factors or symptoms to be aware of: anxiety or changes in mood of depression, body dysmorphia, excessive exercises or exercising, excessive use of the restroom, difficulty concentrating, preoccupation with weight and eating, avoidance of eating, or using laxative or water pills. Disordered eating patterns may impact performance, which may also be an indication to others that help may be required. Performance consequences may include, but are not limited to, the following: glycogen depletion that increases energy and increases risk of muscle energy or weakness. Dieting may also impact VO2 max and running speed. Dehydration, which has been mentioned before, which can impact cognitive function and ability to manage emotions. And importantly, hormonal disruptions that can cause increased risk of overuse injuries.
Once behaviors are recognized, early intervention is key, not only for treatment, but reducing the risk for long-term consequences. Each case is different in terms of what the student athlete may need. Typically, the following providers would be involved to ensure whole person care. Primary care physician, which can include your team physician that would help with diagnosis if trained in mental health conditions. They would also help with regular testing and collaboration of safe return to sports activities. Mental health care provider, which would include a licensed psychologist or counselor to help with improving relationships with food. Sports dietitian, to help with fueling for performance and decreasing risk of injury. Your athletic trainer as a point person and to help support and communicate between all persons. In cases where student athletes need more healthcare attention, there are inpatient, partial hospitalization, and outpatient options available. What does that mean? Inpatient treatment programs are usually multidisciplinary, and treatment focuses on weight restoration, normalizing eating behavior, and facilitating psychological change through nutritional education, supervised meals, individual and group psychotherapy. This can last up to several months. Partial hospitalization or day programs are similar to inpatient treatment in terms of a multidisciplinary approach, treatments offered, and intensity and duration of treatment, but with no overnight stays. They are potentially more flexible and thus amendable to matching the individual level of motivation for change with goals of treatment. Outpatient treatment generally involves once or twice a week sessions with a therapist of a single discipline and may be either individual or family-based. Outpatient treatment provides care in the least restrictive setting and thus are favored by current psychiatric practice.
As coaches or leaders in athletic settings, we can provide an open door and judgment-free space to help our student athletes find help and resources needed to succeed in life and in sport. If you or someone else would like to seek help, talk to your athletic trainer or another confidant in the athletics department to help direct you to the right care. There are national resources available that you can call, chat online, or text for more information.